And you mentioned a team. What's the difference between an anesthesiologist and an anesthetist?
An anesthesiologist is a physician who trains, goes to medical school, 4 years of medical school, 4 years of residency, and some anesthesiologists do an extra year of fellowship to specialize further. A nurse anesthetist is a nurse, goes through nursing school, nursing training. They typically
specialty training.
They typically work for a year or so in the critical care ICU setting after nursing school.
So they know how to take care of sick people.
Exactly, and then they go to the CRNA program, which is, I think, 2.5 to 3 years, which most of them are masters. Some of them are going toward doctorate level programs now, and so that's the differences in the training. Most places, most hospitals work in what's called a care team model. That's the way we work at NASH. We have 5 anesthesiologists and I think approximately 20 CRNAs, and on a daily basis the anesthesiologist supervises up to 4 operating rooms which are occupied by the CRNA. So the CRNA is in the room the entire time. The anesthesiologist is responsible for the whole gamut of the care, pre-op, intraoperative, post-operatively. We are constantly rounding in all the operating rooms, for the inductions, going to sleep, the waking up, the procedures that need to be done, any intraoperative issues or emergencies or crises, well, we attend to those. So we're kind of the overseers. The CRNA is the one who's in the room the whole time. Yeah.
They do the most attentive care. They're standing by you, looking over you, and treating you like family 110% of the time.
But if they need you, you're right there and they can call you.
I'm always immediately available. We have these communication badges called Vocera. If there's any emergency, I get a call, you need to come to OR 5. Within 10 seconds, I'm in that room. Our anesthesia monitoring desk is literally right outside the OR. So when we're not actually in that room, we can see everything that's going on from the vital signs and monitor. And
so the same monitors that are actually displaying your vital signs and your heart rhythms are actually be able to be visualized at the main desk as well.
Correct.
So everybody has 2. They have the anesthetist and an anesthesiologist.
Right, that's what I always like to tell my patients. You're always going to have 2 professional anesthesia providers involved in your care the entire time, from start to finish.
And never are you without somebody touching you.
Correct.
Never at any point. There's always somebody standing over you, paying perfectly close attention, not just to you and watching you, but the density of monitors is very impressive and very modern, and we're going to talk about that in a little bit.